Hello, I am Dr. Gauri Gore from Mumbai. As promised, I'm back with a new video. In the last video, I spoke to you about how to plan for the pregnancy. And today, I'm going to discuss about vaccinations before and during pregnancy. Vaccination is important to prevent infections in the mother and the babies. Now, there are two types of vaccines mainly: a live attenuated vaccine and an inactivated vaccine. During pregnancy, a live attenuated vaccine should not be given. Inactivated vaccines are safe in pregnancy. Before planning a pregnancy, there are some vaccines which are recommended in case you haven't received them before that. These vaccines are MMR or measles, mumps, and rubella vaccine, and HPV or human papilloma virus vaccine. So MMR vaccination is a part of the childhood immunization. So a girl usually would be vaccinated and she will have immunity against this infection. However, if one is not sure about the vaccination status, we can do a blood test to find out if the girl needs vaccination before pregnancy. Remember one thing: if MMR or rubella vaccination is given, then pregnancy has to be avoided for 4 weeks or 28 days from the date of receiving vaccination. If one is not vaccinated and if one gets any of these diseases and infections during pregnancy, there could be possibility of congenital anomalies or miscarriages in pregnancy. So MMR vaccination before pregnancy is extremely crucial. The HPV vaccine is now recommended for all adolescent girls and young adults to prevent possibility of cervical cancer in later life. But HPV vaccine also gives immunity against a lot of other HPV related infections. The total vaccination span is of 6 months. So if you wish to receive vaccine for HPV, then plan it properly. If someone has got one dose of HPV vaccine and then that girl is pregnant, the recommendation is not to go ahead with the vaccination during pregnancy, and the remaining doses can be completed after the childbirth. Now, the vaccines which are to be given to the pregnant mother are mainly two: influenza vaccine, which is again a viral infection, and tetanus, diphtheria, and pertussis. So, tetanus, diphtheria, and pertussis are bacterial infections. In India, a single dose of influenza vaccine is recommended for all pregnant ladies, which is considered as a high risk population for developing complications of influenza infection. And tetanus doses are given to all the pregnant mothers in the government setups, also in the private setup. As of now, we don't use plain tetanus vaccine. We use a combination of the vaccine of TD or tetanus and diphtheria, or Tdap, which is tetanus, diphtheria, and pertussis. The intention of giving vaccines to pregnant mothers is to protect the mother from any infection, but also to protect the child immediately after birth till the time that the newborn's immune system gets developed and the child also starts receiving vaccination as per the protocol. So there is transfer of antibodies across the placenta. So a vaccinated mother protects the child also from some infections in the early stages of life. Apart from these vaccines, in certain specific situations, a lot of other vaccines can be given. Hepatitis B is one such vaccine. Again, in the childhood immunization program, most of the girls would be vaccinated. But if one doesn't know for sure, then hepatitis B vaccine can be given before or even during pregnancy. If there are certain pandemics, for example COVID-19, pregnant ladies can be given some types of vaccines. In certain other conditions and specific situations, For example, if the woman is suffering from a medical condition where her immune status is on the lower side, if she is a transplant survivor, then some more additional vaccines would be recommended for her. If a lady gets bitten by a dog, then a rabies vaccine might be required. So these are the vaccines which will be given only in specific situations, and these vaccines should be received only after a proper medical consultation. So this was all about vaccines. See you soon. Thank you.